Have you ever experienced a strange cramp or feeling of heaviness in your legs while walking? You brushed it off as just a result of getting older or being out of shape. But what if your body is actually trying to warn you about something much more serious, something that could lead to permanent damage or even life-threatening complications? Most people associate artery blockages with the heart, but did you know they can also restrict blood flow to your legs and feet? This condition is known as peripheral artery disease, PAD, and it's more common than you might think. It occurs when plaque builds up in the arteries, narrowing blood flow to your lower limbs. If left untreated, PAD can cause pain, slow healing wounds, infections, and even amputations. Even worse, it significantly increases your risk of a heart attack or stroke. The good news is that if detected early, many of these complications can be prevented. That's why recognizing the warning signs is crucial. In this video, we'll explore 7 critical symptoms of PAD that you should never ignore. Let's dive in. Leg pain or cramping during activity. Have you ever experienced aching, cramping, or a feeling of heaviness in your legs when you start walking or climbing stairs? Maybe it goes away when you rest, so you didn't think much of it. But then, the next time you start moving, it returns. If this sounds familiar, it could be more than just fatigue, it could be a warning sign of PAD. When your arteries are narrowed or blocked, they can't deliver enough oxygen-rich blood to your leg muscles during physical activity. As a result, your muscles struggle, causing pain, cramping, or tightness in your legs. This condition is called intermittent claudication, and it follows a clear pattern. Discomfort starts with movement and disappears with rest. However, as PAD worsens, the pain may occur even when you're sitting still. The location of your pain can also provide clues about where the blockage is. If you feel cramping in your calves, the blockage is likely lower in the leg. Pain in your thighs suggests a blockage higher up, and discomfort in your buttocks may indicate a more severe, widespread problem. Many people dismiss leg pain as a normal part of aging or being out of shape, but this isn't normal. Ignoring it allows PAD to progress, potentially leading to serious complications like non-healing wounds, infections, or even amputation. If you notice this pattern of leg pain, don't brush it off, talk to your doctor. Weak or absent pulses in the legs or feet. One of the earliest and most important signs of PAD is weak or absent pulses in the legs or feet. When arteries become blocked, blood flow to your lower limbs is restricted, making it difficult for doctors, or even you, to feel a pulse in certain areas. During a physical exam, doctors check for pulses in 3 key locations: behind the knee, popliteal artery, on top of the foot, dorsalis pedis artery, and behind the ankle, posterior tibial artery. These areas supply blood to your legs and feet. If your doctor struggles to find a pulse or notices that it feels much weaker than normal, it's a strong indicator that your circulation is compromised. A weak pulse means blood is struggling to flow past a blockage, while a completely absent pulse can signal a more severe obstruction. This is especially concerning because restricted blood flow increases the risk of pain, slow healing wounds, infections, and even tissue death, gangrene. To confirm PAD, doctors use tests like Doppler ultrasound to check blood flow and the ankle brachial index, ABI, to compare blood pressure in your arms and legs. If weak or absent pulses are found, don't ignore them. Early detection can prevent serious complications. Skin color or temperature changes in the legs and feet. Have you ever noticed that one of your legs appears paler than the other when propped up? Or maybe when you're sitting or standing, your foot turns a bluish or purplish tint. These subtle changes might seem harmless, but they could be early warning signs of poor circulation caused by PAD. When blood flow is restricted, your leg may appear much paler when elevated because oxygen-rich blood isn't reaching the tissues effectively. When you lower your leg or stand up, gravity causes blood to pool in the area, leading to a bluish or purplish discoloration. These color changes may start off subtle but become more noticeable as PAD worsens. This happens because blocked arteries prevent enough oxygen and nutrients from reaching your lower limbs. The lack of adequate blood flow affects the health of your skin and its ability to regulate temperature, making the affected leg or foot appear discolored, dry, or thin. Even small changes in skin color could indicate a larger circulation issue. A significant temperature difference between your legs can also be a sign. If one foot or leg feels much colder than the other, blood might not be circulating properly to that limb. If you notice persistent color or temperature changes in your legs or feet, it's essential to take them seriously and consult your doctor. Slow healing sores or wounds. If you've had a small cut or scrape on your leg or foot that refuses to heal, it could be a sign of peripheral artery disease, PAD. Poor circulation due to blocked arteries can prevent wounds from healing, increasing the risk of infection, ulcers, and even gangrene. Slow healing wounds, especially on the feet, should not be ignored. Seek medical help if a wound doesn't heal as expected, especially if you have diabetes, high cholesterol, or high blood pressure. Shiny, hairless skin on the legs. Shiny, tight-looking skin or hair loss on your lower legs may signal PAD. Reduced blood flow to the skin and hair follicles due to blocked arteries can cause these changes. Thin or brittle toenails may also be a sign of poor circulation. If you notice these symptoms, see a doctor as they can indicate PAD and increase the risk of serious complications. Erectile dysfunction. Erectile dysfunction can be an early sign of PAD, as restricted blood flow to the pelvic region may indicate vascular issues. Up to 70% of men with PAD experience these symptoms before noticing leg pain. Poor circulation in the pelvic area may also signal blockages elsewhere in the arteries, increasing the risk of heart problems. Early treatment can improve circulation and prevent severe complications. Numbness or weakness in the legs. Have you ever experienced tingling, numbness, or weakness in your legs that doesn't seem to go away? Maybe your legs feel unusually heavy after sitting for a while, or you notice a pins and needles sensation in your feet. While occasional numbness might not seem concerning, frequent or worsening symptoms could be a serious warning sign of peripheral artery disease, PAD. When blood flow to the legs is restricted due to artery blockages, muscles and nerves don't receive the oxygen and nutrients they need to function properly. This can lead to numbness, tingling, and weakness, making it harder to move around or stand for long periods. Some people describe it as their legs constantly falling asleep, while others feel their muscles are losing strength. If PAD progresses, poor circulation can cause muscle wasting, where muscles shrink due to lack of use and nourishment. These symptoms shouldn't be ignored. They could signal severe artery blockages, increasing the risk of complications like non-healing wounds, infections, and mobility loss. If you frequently experience numbness, weakness, or heaviness in your legs, see your doctor as soon as possible. Early detection and treatment of PAD can improve circulation, restore function, and help prevent more serious complications down the road. Prevention and next steps. Detecting PAD early is crucial, as it not only affects your legs but also significantly increases the risk of heart attacks and strokes. PAD is caused by the same plaque buildup that leads to cardiovascular disease. Ignoring the warning signs can have serious consequences. The good news is that lifestyle changes and medical treatments can improve circulation, reduce symptoms, and prevent complications. The earlier you take action, the better your chances of avoiding severe outcomes like infections, ulcers, or limb loss. Here's what you can do: quit smoking. It's the #1 cause of PAD. Smoking damages blood vessels and accelerates plaque buildup, worsening circulation problems. Eat a heart-healthy diet. Focus on whole foods and avoid processed foods or meals high in cholesterol to help keep arteries clear. Exercise regularly. Walking is especially beneficial for improving blood flow and strengthening your cardiovascular system. Manage conditions like diabetes and high blood pressure. These contribute to arterial damage, so controlling them is crucial. See your doctor regularly. Early testing can detect PAD before symptoms worsen, allowing for timely treatment and a better quality of life. PAD is more than just discomfort in your legs. It's a serious circulatory issue that can lead to pain, infections, heart attacks, strokes, and even amputations if left untreated. The warning signs may start subtly, but they should never be ignored. If you've noticed leg pain, cramping, numbness, skin changes, or slow healing wounds, these could be early indicators of blocked arteries. The sooner you seek medical advice, the better your chances of preventing severe complications. Take care of your legs, they carry you through life. Act now. Quit smoking, eat healthily, stay active, and monitor your vascular health. Don't wait until it's too late. Listen to your body, recognize the signs, and protect your health.